In the UK, demand for care is on the rise. Budgets are stretched and services in England are having to reassemble into a new, very different structure. Now, healthcare is the people who do it, applying a range of extraordinary talents. And in this video, I'm going to talk about what determines our need for healthcare staff and skills, and go some way to answer, do we have enough? And looking ahead, are our services secure? Right, let's kick this video off with the most striking fact around health in the UK, the projected rapid growth in demand. An article in The Lancet last year predicted that obesity in adults in the UK will increase from 23% now to 40% in the year 2030. When you include population growth, it's almost double the number of adults now, and it's a similar picture for dementia, diabetes, and other long-term conditions. The number of us with these conditions is expected to rise sharply, and it's shown here. Now, the year these projections refer to is 2030. It's just 18 years from now. So children born this year, 2012, who go into healthcare, will begin their studies in 2030, and this is what they'll face. So this video is the first of three, discussing the findings of Universities UK report, A Picture of Health and Education. This data-rich publication takes an overview of health education and argues that universities are an indispensable part of the UK's healthcare system. In this video, I'm looking at the context around health education and training, what determines our need for healthcare staff and skills, and what does the future hold. You might think it's all about what the public needs, how many of us there are, and how sick and wretched we are, but it's a lot more complicated than that. There are three main factors. Population needs is one, but the existing service setup and the money available also have a huge bearing on the staff we need. Here are those three areas laid out. We're going to look at them in turn, starting with population needs. So no surprises here. Ultimately, people need healthcare. As of 2012, the UK population is reckoned to be about 63 million, and this is projected to rise 13% to 71 million. Remember that 13%. But this is certainly not the whole story. The age groups where this growth occurs is really important. The over 60s are set to rise by 37%, 5 million more people, and the over 75s by 59%, so that soon more than 1 in 10 of us will be over 75. But on top of this population growth, the prevalence, that's the proportion of a population with a condition, the prevalence of many diseases and conditions is changing too, in some cases leading to very fast rises in the number of sufferers. I showed you this at the start. These are three of the biggest movers. Obesity up 81%, dementia up 72%, very different to that 13% population growth. This will no doubt place a huge burden on the healthcare system. And as the population gets older and sicker, we seem to be expecting more and more from our healthcare services. An Ipsos Mori poll found that the NHS is the second greatest source of national pride, and satisfaction with the NHS is still close to record highs. A fall in coverage or standards will just not go down well. So with this growing and changing population and rising expectations, population demand for healthcare can only increase, and it's changing too. The big questions coming out of this are, how do we meet this demand? Can we do it with existing service models and finances? And can intervention rates really stay the same? If so, how? The next part of the picture is service configuration, what care is currently done, how, and by whom. Now, the way services are arranged never stays still. Changes in demand, best practice, funding, and even political ideology ensure services are perpetually between systems. So what does the UK system have and do? Here is a list of large and medium-sized numbers. Are you ready? We consume over 1 billion NHS prescriptions per year. That's more than 20 per person. There are just over 200,000 NHS hospital beds, which is enough for the city of Newcastle to stay overnight. We have 21,000 nursing homes, 11,000 GPs and dentists, 350 acute NHS hospitals and 200 private acute hospitals. But what about the people who do the caring and the treating? More than 2 million people in the UK work in healthcare, and some large groups of staff are not even employed by the NHS, including pharmacists, private nurses and physios. Our report, however, focuses on the NHS, and the UK NHS staff headcount is broken down into these categories. There are close to 1 million clinically trained staff, including doctors of all kinds, nurses, midwives and health visitors, and also therapeutic staff or allied health professionals. But how do we get here? Since the year 2000, the English NHS workforce in particular has expanded significantly and quickly, by 26% in total, and even faster for doctors, by 50%. The success of this sudden, rapid growth depended a lot on recruiting qualified, experienced staff from abroad. Specialist education systems can't be simply switched on or off when you want to train at home. So as you'd expect, the NHS workforce has become slightly older over this period. After this investment to grow the workforce, how are we doing internationally? We have among the highest numbers of staff per head in the OECD, but we are still behind many key benchmark countries. Now, this only goes so far in answering whether or not we have enough health staff and skills, but where should the UK be? Would you rather be Norway and Germany up near the top? Or say Hungary, where infant mortality is around twice as high? Looking ahead now at service configurations, for future care to be effective but also cost-effective, future patterns of provision will depend on flexible resources, focus on promotion and prevention, shifting care closer to home, and using new service models. All of these developments have an effect on the workforce as they ask for new skills, new or different personnel, and new ways of working. That was a brief overview of service provision. Finally, we're going to look at the resources, that's money, available in the system, both overall and also health education specifically. UK health has its own controversial hockey stick chart. It's not temperature change, but real terms NHS expenditure from the late 1990s to the year 2014-15. And here it is. The UK real terms NHS expenditure doubled from around £60 billion in 1994 to around £125 billion in 2009. And this allowed the NHS to expand its workforce and deliver more care. Notice though the effect from 2009 onwards of the recession. The coalition government pledged that NHS spending will rise in real terms, that is above inflation, to 2014-15. But don't just take my word for it.
The NHS is an intrinsic part of the fabric of our country. It is the embodiment of a fair society. This coalition government made a commitment to protect the NHS and increase health spending every year. Today we honour that commitment in full.
Thank you for that, George, but you can see from the chart that the growth he's talking about will be minimal in comparison to the last 15 years. So after all this, how does our spending compare? The UK is again behind key benchmark countries for health spend per capita and as a percentage of GDP. While healthcare value for money is pretty important, it's still useful to ask where should we be? Should we be dedicating a similar level of resources as Canada or France? Or perhaps keep mingling with the likes of Italy and Spain? What about our investment in health education then? Here, because the situation in England is changing after the Coalition's Health and Social Care Bill, we're focusing on England. While the total NHS budget grew, health education spend in England grew too. The DH in England now spends about £5 billion on education and training, but growth since 2010 has been minimal. This growth in education spend in England has, in fact, been slower than that of the total budget. This means that the proportion of NHS England's spend on education is falling. The two thoughts I want to leave you with from this section are, if the growth in the overall budget is not matched by the investment in health education, what does this say about the sustainability of the staffing and skills levels in our services? Also, how does this reconcile with the picture of growing and changing population needs and evolving service configurations? So to wrap this up, demand for healthcare is growing, and to maintain patient outcomes and satisfaction levels, more care will have to be done. Given the resources available, this care will have to be different, flexible, delivered close to home and using the latest advances. There is therefore a growing and changing demand for healthcare staff, not simply workforce capacity, but also skills. So at this time, while the NHS workforce is in fact ageing, surely the need to invest in healthcare education and training has never been greater. In the next blogs and videos, I will look at the other sections of the report which cover how health education is delivered, the people and places this involves, and also how health education is funded and decided, both now and looking ahead.